Welcome to Advanced Concepts Fluid and Electrolyte Balance, Concept 7. We are going to spend a little bit of time reviewing some things from basic concepts in nursing and maybe hitting on a couple of new things. Just be prepared to discuss in class and take the pre-lecture quiz. The body continually adjusts the characteristics and locations of its fluids through specific physiologic processes that, as nurses, you must understand in order to assist individuals to maintain or restore fluid and electrolyte balance and be able to function optimally. So basically you need to know that the body continually works to maintain homeostasis and a sense of balance. The goals for this concept and additional in-class lecture are going to be objectives 74 through 83. You can see them printed out here on your screen. They are also in your detailed student syllabus. So when you think about fluid and electrolyte balance, it is the process of regulating extracellular fluid volume, body fluid osmolality, and plasma concentrations of electrolytes. So fluid is the water plus substances dissolved and suspended in it. You need to think about things that are going to be important characteristics of fluid. So when you are considering fluid, you need to consider the volume amount, the degree of concentration or osmolality, and then also the electrolytes and substances that are charged particles or those ions when they are involved in that fluid. So we are going to spend some time talking about sodium, calcium, potassium, magnesium, and phosphorus. So all body fluids contain electrolytes specific to that particular body area and location, and we need to have a balance in those in order to maintain optimal functionality. So when you think about the three processes required for optimal fluid and electrolyte balance, you need to think about fluid and electrolyte intake and absorption. So with intake, it can be IV, PO, and G. You also need to think about their absorption. So are they able to move into and out of the blood? Then we need to think about fluid and electrolyte distribution. So moving fluid and electrolytes between the various body fluid compartments. So when we talk about intracellular, extracellular, and interstitial, being aware of how fluid and electrolytes are going to be moving through those compartments. And then lastly, fluid and electrolyte output, removal of fluid and electrolytes from the body, either normal or abnormal routes. So, normal, going to the restroom every day, maybe abnormal, having an NG tube down, having a large gaping wound that has copious amounts of drainage. But in order to have optimal fluid and electrolyte balance, we need to keep the fluid volume, osmolality, and concentrations of fluids in that normal range. So there's some key terms that are listed out on this slide. I'm not going to spend a great deal of time talking about them because we will be continuing to talk about them in class, but you do need to be aware of it. There's also additional terms when you go to eCompanion, and you will find a list of terms on there under fluid and electrolytes, and those are going to be terms that will be used freely in class, freely in lecture, and hopefully you have a good understanding of what they are. So you need to be able to determine the difference between filtration, diffusion, and osmosis. Understand what hydrostatic pressure is. What is the significance of hydrostatic pressure? So take a minute to read in your book and come up with those answers and have a good understanding. When we're talking about the scope of concept, the scope of fluid and electrolyte balance, we need to just be aware that basically it's going to fall in a couple of different categories. When you look at this picture, you can see right down the middle, that's optimal. So that's where we want to be. And then from there, it either goes to excess, too concentrated, hyper, or we're going to go to that deficit side, be too dilute, end up with the hypos. So we're going to spend some time talking about hyper and hypo, kalemia, calcemia, magnesium, phosphorus, lots of different things. So when you think about fluid and electrolyte balance, and you think about it very abstractly, it's either balanced or it's imbalanced. So normal or disrupted. And when you're thinking about fluid balance, you need to think about extracellular fluid volume and the osmolality. And when you think about disrupted or imbalanced, it's either too little or too much, hyper, hypo. And basically that's just going to be misplaced fluid and electrolytes. When you think about electrolyte balance, that kind of requires separate consideration from fluid balance. When you think of fluid balance, you can consider sodium with that, because where goes sodium, so goes water. And so with the osmolality, it's really based on the sodium, where your concentration levels are going to be more based on the different electrolytes. So with review of physiology, you need to think about water regulation, water distribution, role of fluid in the body, electrolyte regulation, electrolyte distribution, and then the physiologic role of electrolytes. These are going to be found in Chapter 13 of your reading. When you're thinking about these many different things, the biggest things that you really want to consider are your aldosterone antidiuretic hormone, natriuretic peptides, and then the renin-angiotensin pathway. And so when you're thinking aldosterone, aldosterone is produced as a result of the renin-angiotensin pathway, and aldosterone acts to regulate fluid volume, much like your antidiuretic hormone. When you're thinking diuretics, obviously you know that causes fluid to be lost. So when we're looking at antidiuretic hormone, that's going to regulate fluid balance by regulating renal excretion of water, but not sodium. So with the antidiuretic hormone, the hypothalamus senses a decrease in blood volume. So if we have a decrease in blood volume, we have an increase in osmolality. And that increase in osmolality is then going to signal the pituitary gland. And that pituitary gland is going to secrete antidiuretic hormone into the bloodstream. The antidiuretic hormone will cause kidneys to retain water. So what happens is it removes water from the renal distal tubules and collecting ducts, and then is going to return that fluid into the blood to increase extracellular fluid volume and then just fluids. So with water being boosted back into the system, it will cause a decrease in osmolality, and then the cycle will stop until the body senses that it needs more fluid. With aldosterone, aldosterone again is involved with that renin-angiotensin pathway, and we will discuss this more in class. With the renin-angiotensin pathway, when you think about the entire cycle, I will draw this out in class and discuss it, but do kind of be aware of it, familiar with it. I'm sure it's something that you've had in basic concepts, but when you have a drop in perfusion, it's going to decrease blood flow to the glomerulus. And then the juxtaglomerular cells will secrete renin into the bloodstream. That renin then travels into the liver, and the renin is converted to angiotensin 1 in the liver. And that is acted upon by angiotensin converting enzyme, or that ACE that we have talked about. And angiotensin 1 is converted to angiotensin 2, which is a powerful vasoconstrictor. That angiotensin 2 is then going to increase peripheral resistance and decrease size of the capillary beds, and that will help elevate your blood pressure. So angiotensin 2 then stimulates adrenal glands to produce aldosterone, and that aldosterone, remember, is going to be the water saving hormone. So when you're thinking about that, the angiotensin 2 pathway is greatly stimulated when a patient has shock or when a stress response is stimulated. So when you're looking at the angiotensin 2 pathway, or you're looking at that patient in shock, urinary output is going to be a good indicator of adequate perfusion. So are we meeting the mark of at least 30 ml in an hour? So kind of being consistent and aware of those types of things. The natriuretic peptide, what we see with that is located in the heart by the atria. And so when blood volume and blood pressure rise, that's what the natriuretic peptide begins to stretch the atria. And so when the atria is being stretched, this peptide shuts off the renin, angiotensin, aldosterone pathway. So that's kind of responsible for helping stabilize blood volume and blood pressure, because we don't want it to get out of control. We don't want to cause our patients to be hypertensive. And so they're all going to really work together to maintain blood pressure and blood volume within the body. So that, in a nutshell, is a brief overview of what we are going to be diving into when you come into class and come into lecture, and we start talking about risk factors for impaired fluid and electrolyte imbalance. So make sure you have a solid understanding of aldosterone, of the angiotensin renin cycle, that you are aware of how the body helps and maintains homeostasis. When you come into class, we will start with this slide number 9, and we will pick up from here and then continue on and talk about hyper and hypos, and then go into our exemplars. If you have any questions, please bring them to class, and we'll discuss them further in class. Thanks so much for your time.